I'm Lisa Mullins in Boston. Dr. Eric Goralnick has spent the past 3 months traveling the state talking with veterans. It's his first act as the state's new Secretary of Veterans Services. The listening tour comes as VA services around the country are facing huge cuts. Dr. Goralnick joins us now to talk about his new position and his aim in the job. Welcome.
Thank you so much, Lisa. Great to be here.
Nice to have you here. So you're coming close to the end of the listening tour across the state. Can you tell us what is top of mind among the people with whom you've spoken?
There are so many challenges right now facing our veterans community, but I have a lot of optimism. And I have optimism because people are showing up. They're talking about what's working, what's not working. You know, one veteran that I met, for example, in North Adams, he's a Vietnam-era veteran in his late 70s, and he spoke about the challenges of trying to still stay at home and maintain his property and still have access to health care when he's losing the ability to drive and get around. And so that's a real challenge for our aging population, particularly veterans.
That's a hard one, though, because there are fault lines on many fronts. It has to do with physical ability. It has to do with aging. It has to do with economics of being able to maintain a home, get around, get access to medical care. How do you even begin to approach that?
In this case, one issue is access, transport. So can we provide some level of service to transport him? Can we partner with local nonprofits to get him to a site? At the Executive Office of Veteran Services, we fund over 20 nonprofits that provide these types of services, including transportation, mental health, access and support for either state or federal benefits, in addition to food insecurities and services for housing insecurity.
So in that particular case with this gentleman, what's going wrong if there are all these services?
Well, what's going wrong with this gentleman, I think that the challenge for him first is transportation, right? And finding the right either nonprofit or other support service that we could identify to help
But you're
him.
saying it's out there.
It's out there, and the challenge is, do we cover that area? Do we have availability for that individual at the time he needs to travel?
The New York Times did an analysis that shows that cuts have created empty slots for more than 1,500 physicians, almost 5,000 nurses, and this is across the country. What specifically do the funding cuts mean for Massachusetts?
I did visit recently with 2 primary sites that serve veterans who live in Massachusetts. They've assured me that services are readily available. I know that we looked at our constituent calls across the state, and it's running at about the same level this year as last year. We had about 350 calls last year, and we're tracking to have a similar number of calls. And those are calls of individuals who live in Massachusetts who've reached out specifically about access to VA medical services.
If you can think of the one item that's at the top of your agenda now, maybe in part based on the feedback that you've gotten in the past couple of months, what is it?
Absolutely. The number one priority for us is those veterans' homes. Number 2 is benefits. And I would say the third piece is helping veterans transition from the military to the civilian world. And the real challenge here is that you're moving from one culture to another, and it's a different language. So I want to focus on the things that veterans can do. And so there's real opportunities to help them, to coach them, to understand what skills they have, what skills they want to develop, and partner with private and public sector to help them find meaningful careers.
Thank you very much, Dr. Eric Goralnick, who is the state's new Secretary of Veterans Services. Nice to have you in. Thank you.
Thanks, Lisa.